here. It's really nice to be here having this conversation just in regards to deep breathing before I go ahead and get started. So I'm a clinical psychologist and I specialize in behavioral sleep problems. And so obviously deep breathing and different relaxation strategies is, very much incorporated in my practice. And for young kids, what I do is I tell them, smell the flowers, blow out the birthday candles. Smell the flowers, blow out the birthday candles. Just for you parents of young children, and for older children, a visual aid could help. So put your hand up, take a deep breath, breathe in, breathe out, breathe in, and breathe out, and to repeat that process a few times. So I just sort of wanted to piggyback on that. I'm going to go ahead and share my screen with you guys. So like I said, I'm a clinical psychologist and I work with kids with sleep problems. So I run a clinic and I consult to KixCare, focusing on children of all ages, 0 through 18. So I just want to share some slides with you. And what we'll be talking about today is I'll be defining what behavior sleep problems are, the importance of the impact of sleep problems on our children. We'll look at sleep needs by age. We'll look at healthy sleep habits, and then I'm happy to answer any questions. So, just in terms of what are pediatric behavior sleep problems, we usually think about it in three categories. So, behavioral insomnia of childhood, psychophysiologic insomnia, and transient sleep disturbances. So, behavioral insomnia of childhood or teenagers, what that's really referring to is looking at how do we fall asleep at night. So, what is sort of a necessary condition or necessary association for the way in which we fall asleep at night? So, for younger children, that might be parental presence, having a parent there in the room with them, having a parent check on them. For teens, what that might look like is falling asleep on a device or, some sort of external source that's needed. And usually the root of that is inadequate limit setting. So, it's easier for a parent to stay with their child until they fall asleep. So they go ahead and they do that. Or it's easier for a parent to just tell their teen, oh, whatever, just be on your phone until you fall asleep. It doesn't really matter. Psychophysiologic insomnia is another type of insomnia that we see, and that's conditioned insomnia. So that is really worrying about having a sleep problem. So sort of that classic, insomnia where you get into bed, where you worry that you're not going to be able to fall asleep even before you go ahead and get into bed. And then once you're in bed, lying in bed thinking, oh no, I'm not going to be able to fall asleep. I'm not going to be able to fall asleep. Sort of that loop, that cognitive loop associated with insomnia. And then transient sleep disturbances are really situational sleep disturbances. So there's an identifiable stressor or identifiable reason that a child or teen can't fall asleep. Okay, so let's talk about pre-pandemic. These numbers are from studies from the 2000s, and my experience tells me that it's a little bit higher. But 20 to 40% of school age children, 6 through 12, were having sleep disturbances pre-pandemic, and 11% of adolescents. But again, my experience is, I think it was higher. But the point is that there's been a considerable increase during the pandemic. So many parents have perceived that their sleep has worsened, by about 40%, and they really attribute increased screen time, anxiety, and decreased exercise to contribute to their sleep difficulties. A meta-analysis done recently showed that nearly 50% of healthy children do not meet sleep recommendations. So let's go ahead and talk about what are the sleep recommendations. So for children ages 6 through 12, it's recommended that they get 9 to 11 hours of nighttime sleep, no napping during the day. And for children for teens ages 13 plus, the recommendation is 8 through 11 hours of sleep and no napping during the day. And the no napping during the day, it may seem obvious, but it's pretty relevant for kids and teens who are experiencing sleep difficulties, because usually around 4 o'clock, if their body wants a nap, they're taking a nap, and that is impeding their nighttime sleep. So in working with kids to get the right amount of sleep, what I often do is I often refer them to sleepfoundation.org. I have them input the time that they need to wake up, and then we count backwards to establish what time they need to go to bed. Let's look at the impact of sleep deprivation on academic performance. So sleep deprivation leads to reduced attention span, impaired memory, poor organizational skills, feelings of frustration, being distracted, and poor motivation. Let's go ahead and look at the impact of sleep deprivation on social emotional functioning. It leads to irritability, anxiety, defiance, poor emotional regulation, anger, and problems with friends. So what's getting in the way of school-age children's sleep? Sort of like the heavy hitters, and certainly there are other things, but the heavy hitters are really parental presence, nighttime phobias and fears, generalized anxiety, electronics, and I would also add, especially recently, lack of scheduling. What contributes to sleep difficulties in teenagers? Anxiety, depression, circadian rhythm disruptions, and that's really the hormonal changes that come along with adolescence that targets them going to bed later and wanting their bodies wanting to go to bed later and wanting to wake up at a later hour. Electronics, and also unstructured schedules, I would add again. Okay, so what do we do with this problem? First of all, I think that it's really important for professionals to screen for it. So this is a really simple screening tool. BEARS, to use the acronym BEARS. So to look for, are there bedtime issues? Is there excessive daytime sleepiness? Is there awakening, or are there awakenings in the night? Is there a regularity of sleep and a regular duration of sleep? And is there snoring? Is snoring present? If there are any sort of sleep issues, a very simple and essential place to start is to look at nighttime habits. So some physical activity before bedtime, limited time in your sleep environment, which is really difficult when our kids are Zooming all day from their bedrooms. Adjust the lighting level, limiting electronics, engaging in some relaxing or calming activities, and then turning the lights out. And turning the lights out is really important. It seems very obvious, but the fact of the matter is, so many kids who I see just happen to fall asleep. It's not purposeful. They're engaged in an activity and they're doing that activity until sleep comes. And I think the idea of a light switch where we wake up, the lights goes on, and we go to sleep. And we intend to go to sleep. The lights go off. I think that that's a really important point.
I think these are really great nighttime habits that everyone's going to be able to take with them and actually try with their families tonight. And a lot of electronics actually come with some of these features built in order to try and program you to get ready for these types of habits.
Yeah. And I think that really in my practice, this is the foundation. I don't talk about teaching your child to sleep through the night without these nighttime habits, and also without an optimal sleep environment. So an optimal sleep environment is dark, quiet, in the same bed every night. That is not necessarily a given for many families. Families of young children could bed hop. Teens could fall asleep, playing video games, maybe in a different space. Anyways, cool side of comfortable and limiting electronics. So lastly, let's talk about when it's indicated to refer to a behavior sleep medicine specialist. When poor sleep is present despite the child or the parent's best efforts, insomnia in patients with medical, psychiatric, or neurotypical comorbidities, when there's excessive daytime sleepiness, when there are safety concerns, and when there are academic concerns that are related to sleepiness, and when there's a comorbid sleep diagnosis, such as a circadian-based disorder or restless leg syndrome or other sleep disorders.